Welcome to the Bystander Intervention presentation. This presentation is by the Well-being and Health Promotion Department. SDSU offers a variety of resources for students, including student health services, well-being health promotion, counseling and psychological services, and the Title IX office. You can learn more about SDSU health and wellness resources by visiting our website. Part of getting acquainted with a new community, whether on campus or off, is being an active member or upstander and knowing the resources on our campus. As an active member, it is crucial that you are familiar with bystander intervention. Bystander intervention is recognizing a potentially harmful situation and actively responding in a way to positively influence the outcome. We want you to feel empowered by your decisions to intervene in situations that can become problematic. Now that you are part of the SDSU community, we all have accountability to one another to create a safer space.
We talked a little bit about using university resources and helping others by linking them up with the resources that they may need. But there's more that you can do beyond referring to these resources. You can also get involved and intervene when you see a problem or emergency unfolding. And we'll explain and give some examples of how you can do that throughout this presentation. But first, we want to talk more in depth about bystander intervention. This is important to understand as a foundation for actively intervening. So, what is a bystander? Basically, a bystander is exactly as it sounds, someone who stands by and does nothing. There's a very prominent psychological theory describing this phenomenon, and it's called the bystander effect. The bystander effect states that the greater the number of people standing around not doing anything, the less likely an individual is to help. In fact, we see a direct correlation in research of this effect. The more individuals standing around doing nothing, the more bystanders are created. This means the more people there are, the less likely it is that someone will step in and intervene. So we just talked about this prominent theory and we know it happens, but why don't we help? What's preventing us from getting involved in a situation and intervening? Many of us have most likely experienced a time when we should have stepped in but didn't. Maybe you felt weird or you thought it might be socially inappropriate or that the person might be embarrassed if you helped. You might be worried that you're misinterpreting the situation and the person doesn't need help. And it could just be awkward to intervene when you don't know what to do.
As we explained, this effect has been heavily researched, and psychologists have come up with 6 factors that make the bystander effect more likely to happen. Diffusion of responsibility. When there are more people around, you may feel less responsible. In other words, the responsibility is shared by more people and less falls on you. Depending on others for social cues. Humans depend on each other for social cues for almost all of their actions and responses. So it's not surprising that if no one is cueing you to act or do anything, you may likely assume they know something you don't and follow their lead. The assumption that someone else would call for help or that someone else will step in and take care of the issue. Ambiguity of the situation. The situation may be ambiguous and you may not know what to do, if you should do anything, or if there may be potential risks or harm to you if you do intervene. Trust your instincts in these situations. Feeling that it is socially inappropriate to act. It could feel strange to help someone when everyone else is just standing there looking at you. The tendency to misinterpret. You may misinterpret the seriousness of a situation when nobody takes action. It is easy to downplay the importance of what is going on when no one is doing anything.
Let's discuss some intervention strategies and the steps you need to know when intervening in a problematic situation. The first thing you should do is evaluate the situation to determine if it is an emergency or a non-emergency. An emergency unfolds quickly and requires an immediate helping response. Someone is in a life-threatening situation. This could involve someone being seriously injured or having alcohol poisoning. In emergencies, we know to call 911. Something is happening right then and you need to get help immediately. In comparison, a non-emergency is a slowly unfolding event that allows time for you to plan your intervention. A non-emergency can be something that may turn into an emergency later, but is pretty much anything that is a problem, but that doesn't fall into this immediate emergency category. This allows you some time to think about how you want to intervene and gives you some time to plan. If you are unsure if a situation is an emergency, call the non-emergency advice line for guidance. This number is listed for you on the screen. Feel free to add it as a contact to your phone. Let's move on to the next step, which is deciding how you want to intervene. There are two ways to intervene: directly, which can involve talking to the person directly or engaging directly, or indirectly, intervening by eliciting the help of others. What are possible indirect interventions? You could elicit the help of staff, RAs, or even friends. Did you know that faculty, staff, and RAs have all been trained on how to deal with sensitive issues? You can always go to them if you need help and you don't feel comfortable intervening yourself. After you have decided if the situation is an emergency or a non-emergency, and if you want to directly or indirectly intervene, you have one more choice to make about how exactly you are going to intervene. Two of the primary ways to intervene are either shift the focus or shift the person. Shifting the focus is looking for ways to intervene that will disrupt a situation that is currently heading in a bad direction. This is typically used when the circumstances of the situation are the problem. For example, if there are a ton of people drinking at a party and it's out of control, you could hide the alcohol. This would be an example of shifting the focus. Shifting the person would involve educating the other person in order to change their thought patterns. For example, if you are concerned about a friend who is drinking too much, you could maybe cut them off that night or distract them. But the next day, you could sit down and talk with them about this potentially being an ongoing problem. Shifting the focus is more circumstantial or situational, whereas shifting the person is about trying to alter their thinking or behaviors. Now, I know this is a lot of information. To help you remember your options for intervening, you can think of the 4 Ds. Direct. Respond directly to the situation. Go up directly to the person and stop the unfolding of a potentially bad and dangerous situation. Distract. Distract the person with a conversation or an activity. Be creative and use your best judgment. Delegate. Bring in a third party to help. This is good for situations where you feel unsafe to intervene alone or are unsure how to intervene. Delay. If you can't do anything in the moment, check in with the person after to offer support and resources. Now, let's take some time to discuss a few situations where you may need to intervene.
Scenario 1. You are out with friends. One friend had a hard week of midterms. You know that they have been looking forward to letting loose this weekend. They pre-gamed pretty hard and continued drinking well into the night. Would you consider this an emergency situation? This is probably not an emergency at this point, but in this situation, you could consider shifting the focus away from drinking and engage in another activity. What signs would lead us to think that this has changed into an emergency situation? If the person becomes responsive, if they have cold, clammy skin, if they have shallow breathing, if they are vomiting. These are all signs of alcohol poisoning. If you notice these signs, call 911 and lay the person on the side, often known as the recovery position, and do not leave them alone. So let's go back to the actual situation. You can consider the situation and how you may react. You can use the 4 Ds of intervention: direct, distract, delegate, or delay. Now let's discuss a different party scenario. So if you come across a situation at a party, do you think this is an emergency? This would probably depend on if the individuals know each other, they're in a relationship, did they just meet, are they intoxicated? What would cause you to feel like you should intervene? Maybe if either partner is being aggressive, either partner is pulling away, if either partner is expressing unease either verbally or non-verbally, if either partner appears to be leading the person away from the group, maybe forcefully. What do? You can get them apart and check in. What do you say? See if there are any indirect ways that you can help.
Scenario 3. Another example. Someone has had too much to drink and is being helped away from the party. Is this an emergency? If you see someone drunk being physically helped out of a party, check in. Ask if they know the person they are carrying and ask how they know the person. If the person being helped can speak, ask them to confirm this information. It may feel like you're being nosy, but you'd be surprised what people will tell you if you just ask. If you see any red flags, get the party host to help you keep those people there until you can locate the friends of the person that is drunk. And if they are incapacitated, call for help. On that note, it is important to remember that many drugs that can be used to incapacitate folks can be easily slipped into drinks. Watch your drink and others' when you're out, and if you see something, say something. Say something in the moment to get someone out of harm's way and to report it later. That being said, the number one date rape drug is alcohol. If you see someone pushing large amounts of alcohol on someone else, it's possible that they're trying to get someone to let their guard down. Check in on the situation and intervene. If anyone is swaying, slurring their words, or overly intoxicated, keep in mind that they are very likely too intoxicated to consent. We want you to feel motivated to check in with people when something feels off. Also, if someone is completely incapacitated, they are not safe if left to sleep it off. Unfortunately, for someone with bad intentions, this may be a perfect victim of a sexual assault. People may get more drunk throughout the night as their body continues to metabolize the alcohol, and they may have other drugs or be on prescription drugs that you don't know about. You need to get someone who is incapacitated medical intervention. Call 911, and if you are truly unsure, you can call the non-emergency advice line for guidance. If you call for help or report incidents to the school, please know that our priority is student health and safety. The Good Samaritan and amnesty policies exist to encourage you to seek assistance without fear of sanctions. If a friend needs help, don't worry about getting in trouble.
The Good Samaritan policy. This policy incentivizes students to prioritize the health and safety of the student community. The policy removes conduct penalties for certain alcohol and other drug violations. This applies when a student seeks timely assistance from appropriate emergency personnel and/or SDSU staff for any student impacted by alcohol or other drugs. We need you to trust your instincts in situations when you feel someone might not be safe. Ask questions, get backup through friends and emergency help if needed, and do something. You can always apologize later for being overly concerned. Show your friends in your community that you care about them, and remember you would want help if you were in a sketchy situation. You can review the SDSU Good Samaritan policy on the SDSU website. Scenario 4. Your friend tells you that they have experienced a sexual assault. So, what would you do if someone discloses to you? It's important to listen and believe. They are already upset. Be there for them and do not ask questions like, "Are you sure? Were you drinking? What were you wearing?" Be a good friend. Give them options and resources. There are many resources on campus that could help. This includes university police, counseling and psychological services, student health services, Title IX coordinator, and deputy coordinators, and the SDSU Sexual Assault Victims Advocate. SDSU Talks. You can use this website to locate resources and connect others with support services for victims of sexual assault. The final step is to let them choose what they want to do and support that decision. There are many different responses to sexual assault, and it's not your place to pass judgment on someone or on what they want to do about the assault. You need to give them the options and let them drive the choices.
Scenario 5. You are concerned about a friend. They have not been attending their classes, they have been hanging out with friends less and less, and seem to be withdrawing from the things they used to enjoy in life. Is this an emergency or a non-emergency? It could be either, right? So what are we concerned about here? Depression, possible suicide? What would you do? How do you intervene? You could consider pulling them aside and talking to them, perhaps invite them to do something social. If you believe someone is feeling suicidal, the best way to talk to someone about it is to ask directly. It may feel counterintuitive, but psychologists say that being direct is the best way. Ask, are you thinking about hurting yourself? Or are you thinking about killing yourself? Is this awkward? Probably, but you are not putting the idea in their head and you will not be pushing them in that direction. It may feel uncomfortable to just say it, but if someone is really struggling and it has crossed your mind that they may be thinking about suicide, the best thing to do is directly speak to them about it. Now, what if they don't seem suicidal, but you still think they need help? You could always refer them to counseling and psychological services where they could make an appointment for free. Consider offering to help them make an appointment if they seem interested. You can also call counseling and psychological services yourself and talk to a therapist about advice on how to approach someone or get examples of language to use to help them. And this brings up an important point. We have talked about the bystander effect, and we understand that the more people, the more likely the effect is to take place. Now, we are in a community of over 35,000 students, so it is very likely to take place during your time at SDSU. You may think to yourself, well, I don't know this person that well, or they have friends who can step in, but that's exactly how people fall through the cracks. So please, help those who are in need. Reach out and step in wherever you can. And if you don't feel like you can do so, you can indirectly intervene by getting someone you trust to help out. Let's all strive to make this a healthy and safer community. With that, we want to thank you for listening to our presentation on bystander intervention. We hope that you have learned something and that you feel more empowered to be an upstander on campus. Feel free to follow our social media pages for more information, health tips, and find out about upcoming events.